Hi guys, so this is table 9. So today we're gonna present about the patient diagnosis about our patient Alma, and this is by Jack Ho, Yiren Wang, Bayliee, and Philip, and we are in table 9 in period 1 HBS honor.
Our patient Alma is a 38-year-old woman that has a medical history of bipolar disorder and panic disorder since she was in her 20s. For 15 years, she has been treated with antidepressants and sedatives to help control her anxiety. The problem started earlier in the year where she was contracting a mild fever and feeling pressure in her chest, which brings us to why she's in the hospital now. Alma was administered to the hospital with reported signs of tachycardia, a heart rate that is over 100 beats per minute, which hers is around 148 beats per minute, inability to swallow food causing her to throw up, worsening of her panic and bipolar disorder, and the painful, gritty feeling and bulging of her eyes.
Next, we have some possible conditions for Alma. First, thyroid storm. The symptoms include high fever, severe tachycardia, tremors, agitation, delirium, diarrhea, and vomiting, all of which correspond to Alma's symptoms. However, the proptosis, ventral bulging of the eye, is not explained by thyroid storm. In the cause, this condition is often triggered by severe emotional stress, infection, trauma, surgery, or untreated severe hypothyroidism. For Alma, it may be caused by her severe emotional distress, such as bipolar disorder and panic disorder, but it's still enough to confirm the diagnosis. Relationship between gland and hormone. Thyroid storm is a life-threatening extreme manifestation of thyrotoxicosis, where the thyroid gland rapidly releases excessive amounts of thyroid hormones into the bloodstream, triggering a severe hypermetabolic state. Second possible condition, pheochromocytoma. Symptoms: adrenal tumors can cause severe hypertension, pounding heart palpitations, severe headache, profuse sweating, episodic anxiety, tremors, pallor, and nausea. Alma only has heart palpitations and nausea that match this disease. Her pain and gritty feeling in her eye are not presented in this disease. Causes include stress, physical or emotional stress, medications, anesthesia, certain medications or contrast dye, physical activity, intense physical activity or abdominal pressure. Alma's emotional stress, bipolar disorder, and panic disorder might cause this disease, but her symptoms does not match to this disease completely, so it may not be pheochromocytoma. Gland and hormone. Adrenal gland, where the overproduction of norepinephrine and epinephrine.
Another possible condition for Alma's symptoms is Graves' disease ophthalmopathy. Symptoms include the outward bulging of eyes, the inability to swallow foods because of the inflamed thyroid, compression in the chest, and worsening of mental disorders such as panic and bipolar disorder, all of which are symptoms that Anna has been experiencing. The cause of Graves' disease is the autoimmune cells attacking the thyroid, the cause of which is still unknown, but theories suggest environmental factors are the cause, where the antibody thyroid stimulating immunoglobulin, or TSI, attaches to healthy thyroid cells and causing the thyroid to overproduce the thyroid hormones. Well, as stated, the gland involved with Graves' disease is thyroid, and the hormones are T4, which is thyroxine, and T3, which is triiodiothioxine, which are being overproduced because of Graves' disease, which control action/metabolism of the cells. For our diagnostic testing, our preliminary diagnosis is Graves' disease, To confirm this, we asked for tests of Anna's blood for thyroid-stimulating hormone (TSH), which is the hormone produced by the pituitary gland to tell the thyroid to produce thyroid hormones. And then we asked for another test for thyroid hormones, and the results came back as normal for the TSH, but high for thyroid hormones as T3 and T4, which is stated in the earlier slide. Which then it prompted us to take an MRI of her neck, showing that she has an enlarged thyroid, confirming the diagnosis of Graves' disease.
Okay, the final diagnosis that we gave Alma was Graves' disease. It was noted that Alma has intense heart palpitations and tachycardia. She also experiences weight loss, vomiting, difficulty swallowing, and bulging eyes. All of these symptoms match up with Graves' disease. The condition causes the thyroid gland to produce too much thyroid hormones, leading to weight loss and rapid heartbeat, which is similar to Alma's case. It's shown in her diagnostic test that she had an enlarged thyroid, which is also known as goiter, that can cause difficulty in swallowing, bulging eyes, and degrading feeling, all matching up with the symptoms of Graves' disease. After testing for T3 and T4, it was revealed that she has high T3 and T4 hormones, reassuring the diagnosis.
And next, I'm gonna talk about the treatment plan for Alma. So the first treatment plan will be total thyroidectomy surgery for long-term cure. So what is that? It is a surgical removal of the entire thyroid gland. And why for Alma? Because she has an active ophthalmopathy, which is a bulging eyes. Radioactive iodine is risky. It can worsen the ICC, and surgery removes the source of the problems quickly and protects her eyes from further damage. So what is the practical benefit for this treatment plan? So it is a permanent cure. It resolves hyperthyroidism and prevents worsening of bulging eyes. So the second treatment plan that I'm gonna design for Alma is a beta blocker for immediate symptom relief. So what is a beta blocker? It's a high dose propranolol, which is an oral or 4. Why for Alma? It can quickly slows her heart rate from 148 BPM and reduces palpitations and decreases anxiety. It also blocks the conversion of T4 to the more active T3 hormone. What is a practical benefit for that? This treatment plan can provide near immediate relief, while other treatment takes effect. The third treatment plan that we designed for Alma is antithyroid medication, which is a methimazole, to block hormone production. So what is that? Daily oral methimazole, high initial dose, tapered as thyroid level normalized. So why for Alma? It can directly stop the thyroid from producing excess hormones, gradually reversing symptoms like vomiting, weight loss, and tachycardia. What is the practical benefit for that? It is non-invasive, can be used to achieve euthyroid state before surgery. Also serves as a long-term treatment option if surgery is delayed or declined. Treatment often lasts like 12 to 18 months with a 30% to 70% remission rate. And last is the resource citation. Thank you guys for listening. Have a good day.